Two cases of Omicron in India, but a million different questions on what this means for us. Is our approach correct? Should we impose more curbs in anticipation of cases spiking? What do we really know about the nature of this new variant that has pressed the panic button globally? Dr. Roderico Ofrin, the WHO India representative, joins us exclusively on NDTV to answer some of those questions. Thanks very much, Dr. Ofrin, for speaking with us. I want to begin by asking you, how serious is Omicron? It's been indicated by the government here that it could perhaps be less severe. What more can you tell us?
Well, the concern, that's why it's labeled as a variant of concern, is that this variant has over 50 mutations, and some are in the most important proteins that are on which our response tools are based. So, more importantly, preliminary evidence suggests higher transmissibility. There is also a suggestion that it can escape the immune response, whether from previous infection, and that could lead to a surge of cases. Regardless of its severity, increase in cases alone poses stress to whether it's a home, a household, if you're a mild case, or eventually possibly an overwhelming demand in healthcare systems. The reason not to be in a mode of super concerned or super in panic is that because the tools that fight COVID are still there and they're effective. And as such, we are still dealing with a relative new pathogen. WHO is working with technical partners to understand the potential impact of this variant on all our existing countermeasures, including vaccines. And more information will come in the next weeks, if not the days ahead.
You know, one of the concerns here is that South Africa, of course, was the first to have reported, this particular variant. And many believe that this country is now being punished because of the travel restrictions that were imposed. India has put South Africa on a high-risk group. Now, do you fear that this is going to impact how countries report variants in the future? Is that a cause of concern?
It's quite unfortunate that South Africa was able to identify this and report and share, and there were travel bans imposed on them. In fact, just to correct you on that, India has adopted the right approach. It's a risk approach for testing and tracking. They did not put a travel ban on flights from South Africa. It's massive testing of passengers from these countries that are deemed at risk and the regions that are reporting Omicron.
Right. My question is, do you think it's going to deter countries from reporting variants in the future?
Well, I hope not, and that we learn from this. This pandemic is making countries really learn every time a new aspect of the response, that as part even of international health regulations, being able to report a new disease, a new variant of an existing disease, it helps the global response altogether.
Speaking of global response, where does the WHO stand on how the Indian government is currently dealing with Omicron, whether it is the strategy on prevention or containment?
So just to be very clear that when WHO talks about public health and social measures, it does not mean lockdowns. WHO recommends countries that apply a risk-based and scientific approach in its response. All priority public health actions in responding to SARS-CoV-2 or COVID apply to this new variant of Omicron. And it's really, the country has its capacities well built and established. One, to reduce exposure, the systems for test, trace, and treat, including genomic sequencing, is all it's come together. It's the surveillance information platform plus your the sequencing platform from INSACOG are systems that speak to each other. These systems to suppress transmission, which is really your COVID-appropriate behaviors, whereas and it's a plea now to all your viewers to follow the 3 Ws. wear a mask properly, wash your hands, watch your distance, and the 2 Vs, vaccination and stay in well-ventilated places. These are all very effective in reducing transmission, and all of us can do something about it to protect ourselves and others.
Right.
Protecting the vulnerable, 1 billion doses, it's in 10 months. And now a focus really on getting all those with needing a second dose or haven't had their first dose as of yet through a big campaign, Hargar Dastak.
Right.
Is really the approach that also WHO is recommending. Strategically, get everyone vaccinated with those 2 doses because that's effective. That will then go to the next issue of reducing severe illness and deaths because you prevent people from getting to moderate to severe. It's just, if at all, mild disease, and preparing hospitals. And lastly, through you, the media, is to strengthen the knowledge of communities and engage people that there is something you can do to end this pandemic.
You've spoken of preparation and of strategy, but I'll just ask you, patient number 1 from South Africa who was diagnosed with Omicron here in India tested negative and left the country by the time we knew it was Omicron. Does India need to do more and perhaps faster genome sequencing?
India has the systems for genome sequencing with its almost 270 labs plus 18 sentinel sites. It's one of the countries in the WHO mapping of capacities, which has really a commendable place for a country of this population and this density of capability to be able to collect samples and sequence them. So it's just a matter of really connecting that and with regular surveillance. There's the testing and the sequencing is all there.
Right. Dr. Ofrin, you also spoke about strategic vaccination. Now, there is a government panel that has recommended boosters for those above the age of 40 here in India. Should India consider booster shots in the light of Omicron?
Again, I'll repeat that what protects people is getting those 2 doses. And if you protect most of your population, all of your population, versus having more doses for a certain segment of the population, then you lose out in terms of protecting more people from severe disease or death. And that's why this is really the strategic way of vaccination in this stage of the pandemic. In all countries, cases and deaths are predominantly occurring among unvaccinated people. That you've seen in more developed countries, which have access to a vaccine, which is quite sad. And again, it's maybe to also look at if there's any space for boosters. It's for the chronically ill, those who are having possible prolonged being immunocompromised for a long period, such as cancer patients that are undergoing chemotherapy. Those may be considered for booster shots.
Right.
The WHO SAGE does recommend that. For such patients and people.
Okay, so you're saying boosters, at least for the immunocompromised, need to be considered at the moment. But what about vaccination for our healthcare and frontline workers who were vaccinated more than 8 months ago?
Well, that's something to be studied further. Dealing with boosters is not a straight and simple, straightforward issue of getting the next jab. Yes. And that requires the experts, a technical advisory group for immunization of India as well as NECVAC to take this further up.
All right. My last question to you. A lot of young adults have been infected in South Africa with Omicron. How are kids affected by Omicron? Do we know anything more about this, especially because kids here in India are still not vaccinated?
As of now, we don't have that information. The current cases are with young adults or they were university students. It's the younger population, but not children. When there is more information, as I said, and that's why the collaboration between scientists across the world is so important, then of course WHO globally, even through us, our office here in India, will be able to release and inform you through your channel.
All right. Well, Dr. Ofrin, thanks very much for sparing your time and speaking to NDTV.